Good morning, everyone. My name is Aman Virkar. Our group is going to present our project, which is on systemic hypertension. My topic is what is systemic hypertension and its pathophysiology. What is systemic hypertension? Systemic hypertension is high blood pressure in the systemic arteries, the vessels that carry blood from the heart to the body's tissues. High systemic blood pressure is usually caused by the constriction of the small arteries. Pathophysiology. Hypertension or high blood pressure is being seen more often during childhood and adolescence. Blood pressure is a product of peripheral vascular resistance and cardiac output. An increase in cardiac output or peripheral resistance results in an increase in blood pressure. Systemic blood pressure increases with age and is correlated with age, sex, and height throughout childhood and adolescence. An abnormal blood pressure reading should be measured and confirmed by auscultations on 3 different occasions before a diagnosis is made. Blood pressure definitions as defined by the American Academy of Pediatrics include the following: normal blood pressure below the 19th percentile for the age, height, and sex of the child, or an indulgence is less than 120/80 mmHg. Elevated blood pressure between the 19th and 95th percentile, or in adolescence is 120/80 to 129/80 mmHg. Stage 1 hypertension. Blood pressure above the 19th percentile to 95th percentile plus 12 mmHg, or in adolescence is 130/80 to 130/89 mmHg. Stage 2 hypertension. Blood pressure above the 95th percentile plus 12 mmHg, or greater than 140/90. Thank you. Now I'm going to hand over to Navdeep.
Thank you, Aman, and good morning, everyone. My name is Navdeep Hundal. So I'm going to present on topic statistics of systematic hypertension. One study revealed that only 26% of children with high blood consistent with hypertension documented in an electronic medical record were subsequently diagnosed as having hypertension. In 2017, the American Academy of Pediatrics updated its clinical practice guideline for the screening and management of high blood pressure in children and adolescents. A 2018 study has already demonstrated a significant increase in hypertension diagnosis using the updated guideline. Furthermore, use of the new guideline demonstrated increased sensitivity in identification of hypertensive and organ damage. Primary hypertension is now the most common cause of hypertension in children and adolescents. A history and physical examination targeting screening tests should be done to evaluate for underlying medical disorders, and children and adolescents with hypertension should be screened for cardiovascular diseases, including diabetes mellitus and hyperlipidemia. Any stage of hypertension associated with chronic kidney disease or persistent hypertension, despite a trail of lifestyle modification, require antihypertensive medications and should be evaluated for cardiovascular damage with echocardiography. Thank you. And now I'm going to hand over to Kamaljeet Kaur.
Good morning. This is Kamaljeet Lali, and thank you, Navdeep, for handing over. So I'm going with the sign and symptom of systemic hypertension. Some of the patients, they are asymptomatic, usually the hypertension is noted during their physical checkup. Second, some may experience headache, dizziness, blurred vision, and nosebleed. So there are some diagnostic tests to rule out, is there a systemic hypertension or is there any another underlying issue that will causing the issue. So first thing, the doctor will order renal ultrasonography, complete blood count. There will necessary to assess the underlying renal disease. Second thing, fasting glucose or A1C to assess if there is any diabetes mellitus and fatty liver issue or any another cardiovascular risk factor. Third is lipid profile, assess for an additional cardiovascular disease risk factor. And the last one is echocardiography, assess for any cardiac target organ damage. So thank you so much. So I'm going to hand over to Shashna for the complications. Thank you.
Hi, I'm Seshna and I did my own complication. Some of the complications of systemic hypertension would include stroke, heart attack, heart failure, kidney disease, trouble understanding or memory impairment, and aneurysm. Next slide. According to the online article on the Mayo Clinic website, it mentioned the younger a child is, the more likely it is that the high blood pressure is caused by a specific and identifiable medical condition. This means that systemic hypertension in pediatricians is most likely to occur due to a medical condition, and identifying them can help with management plans. Health conditions such as no exercise or poor nutrition and obesity can be add-ons to the complication for systemic hypertension. These can further affect the body system such as heart and cause complications that lead to the complications as mentioned above, such as stroke, heart attack, heart failure, and even kidney disease. Thank you. Moving on to Sandeep.
Thank you, Sashna. Today, my topic is treatment and nursing care, lifestyle management, nutritional counseling, weight reduction, and an age-appropriate program of aerobic exercise. Adults should be consulted concerning the adverse effect of drugs, alcohol, tobacco on the blood pressure. There is evidence that the ingestion of caffeine, the use of over-the-counter drugs such as NSAIDs, herbals, nutritional supplements, and hormone contraceptives may be associated with the development of hypertension in children and adolescents. Next slide, please. Thank you. Maintain a normal body mass index, avoid excess sodium intake, consume a DASH diet, practice in a regular physical activity. The parents and the child should be educated concerning the lifestyle change to ensure active involvement in the child care. Sedentary activity should be limited to 2 hours per day, and at least 30 to 60 minutes of active daily exercise is recommended for children. Anti-hypertensive medications such as ACE inhibitors, ARBs, calcium channel blockers, thiazide diuretics, etc. Drug therapy may not be effective in adolescents who are often incompliant with long-term regimens. The nurse should support the adolescent and parent by providing positive acceptance of diet, medication, and exercise. Thank you. Now I'm gonna hand over to Joshan.
Thank you. My topic is preventions. High blood pressure is treated similarly in children and adults, usually starting with lifestyle changes. Even if a child takes medication for high blood pressure, lifestyle changes can make the medication work better. Control your child's weight. If your child is overweight, achieving a healthy weight or maintaining the same weight while getting taller can lower blood pressure. Give your child a healthy diet. Encourage your child to eat a heart healthy diet emphasizing fruits, vegetables, whole grains, low fat dairy products and lean sources of protein such as fish and beans and limiting fat and sugar. Decrease salt in your child's diet. Cutting the amount of salt in your child's diet will help lower his or her blood pressure. Children ages 2 to 3 should not have more than 1200 milligrams of sodium a day, and other children should not have more than 1500 milligrams a day. Next slide. Encourage physical activity. All children should get 60 minutes of moderate to vigorous physical activity a day. Exercise can help you maintain a healthy weight and lower your blood pressure. Limit screen time. To encourage your child to be more active, limit time in front of television, computer, or other devices. Get the family involved. It can be hard for your child to make healthy lifestyle changes if other family members don't eat well or exercise. Set a good example. Your whole family will benefit from eating better. Create family fun by playing together, like ride bikes, play catch, or take a walk. Thank you. Now I'm going to hand over to Jaskiral. Jaskirat, you're unmute. You need to unmute.
Hi, I'm going to talk about a patient-parent teaching diet, reducing salt intake and eating more fresh fruits and vegetables and low-fat diet pro- products can help to reduce blood pressure in children and adolescents with the hypertension when possible. The entire family should make their changes to encourage the child to develop healthy eating habits. Energy drinks have a high content of sugar and caffeine and other stimulations and can agitate weight, heart rhythm, and blood pressure problems and should be avoided. Smoking and alcohol. Children and adolescents who have hypertension should not smoke because it significantly increases their risk of heart disease and lung disease. Next slide, please. Weight loss in children who are overweight needs to losing weight can help to lower blood pressure. In some cases, the child will be referred to nutritionists who can work with the child and the patients to formulate a healthy dieting plan. Exercise. Regular exercise helps lower blood pressure. Can be lower blood pressure even if the weight is normal. Although exercise recommendations for the individual child may vary, general recommendations include the following: 20 to 30 minutes of aerobic exercise per day, most days of the week. Aerobic exercise includes walking, swimming, and biking, but not weightlifting and strength training. Secondary activities. Watching television and playing video games and computer should be limited to less than 2 hours per day. Now, next is for our references. Thank you, everyone. Next slide. Here is all our references. Thank you, everyone.